Thanks for joining me today. My name's Balika, and I'm here to talk to you about traditional Chinese medicine, which involves acupuncture, herbs, and several accessory modalities as well. I've brought my beautiful assistant here to show the channels on which the acupuncture points lie. There's over 360 acupuncture points that are on 14 different channels, or also known as meridians, that traverse the body. And those are how we access the qi, which is the vital essence or the energy of the body, in order to bring you back into balance. So the nice thing about acupuncture is it's not the kind of medicine where we have to be like, diagnose you with one thing, treat you one way. In fact, there's a saying in Chinese medicine that goes, one disease, many patterns, one pattern, many diseases. So if somebody comes in, say, with headaches, that would be their disease. But there's many underlying patterns that we look at the whole patient and their whole body to sort of try to figure out what's that underlying imbalance, so we can bring you back into your best wellness and make you your best self by finding that underlying pattern and treating there. So sometimes there might be a bunch of different symptoms you're experiencing that don't seem connected, that actually help me discover what that pattern is. Like perhaps you have irritable bowel syndrome occasionally, and there's, this pain in my ankle that won't go away. And of course those headaches I told you about that seem to be stress headaches in the occipital region, but sometimes creep around. And I have some ringing in my ears and occasional night blindness. When I'm out driving at night, it's harder to see. All those things, when we put them together, can show us what the underlying imbalance is, and by formulating that diagnostic pattern, I can then go and formulate a treatment strategy which will help you be your best self. And hopefully those things will start checking off the list. Frequently I see with my patients, they'll come in with a whole list of goals of things we want to accomplish, and we'll be getting through them week by week. Usually most patients come in once a week until they start feeling better, and then we cut down to twice a month or once a month once they start responding to treatment. It depends. The longer you've let an issue go, sometimes the harder it is to bring the body back into balance. So I do encourage you, if you're interested in this medicine and you are having any sort of issues, or even if you just want to feel better than you already do, to get started right away so we can help you get back to your best self. So just a little PowerPoint here to talk about sort of the history of Chinese medicine. So since we're at the World of Books Day, I wanted to talk about the books that Chinese medicine was originally based on. So traditional Chinese medicine, also known as TCM, includes acupuncture, herbs, and accessories techniques, as I mentioned before. And the first book was called the Huangdi Neijing. And that was written between, I think, 305 and 204 BC. Huangdi Neijing translates into the inner canon of the Yellow Emperor. So the book is written in sort of like a dialectic, like Plato used to do, where there's a question and there's an answer, with the Yellow Emperor being the teacher and his many ministers being the ones who are asking him questions and trying to suss out these greater knowledge about how to help the people in ancient China. So that was the original book, and then it became separated into two parts. The first was Su Wen, which was the questioning part, the simple questions, where they talked sort of about the anatomy, physiology, and pathology, and different differentiation of syndromes and preventative treatment. So that was more about the diseases, and then the Ling Shu, the miraculous pivot, focused more on how to treat those things with acupuncture, and that's where we learn about the meridian channels, as seen here on our gold woman, and also discussing the Zang Fu organs. That's something that's sort of coming more into Western medicine now, is the idea that emotions play into disease. And in ancient Chinese medicine, the Zang Fu organs, so those are the major organs, Zang being the hard, solid organs like the liver and the heart, and the Fu being the empty organs like the intestines and the stomach, which things pass through. through. And each of those organs actually has a corresponding emotion. So my master's thesis was on the treatment of PTSD and addiction through the auricular channels. So I've got this little ear here, and by accessing the organs through the ear, we can treat the emotions that are behind PTSD. And I extended my theory into treating those emotions in children in schools who are having dysregulated emotions and have to leave the classroom. By using, rather than needles, using ear seeds, we can allow those kids to have sort of like a magic button to sort of push on to help them re-regulate their nervous system. And those points include the sympathetic point, which is up here, which allows your sympathetic nervous system to go back into a peaceful parasympathetic mode rather than fight or flight. Shen Men, which is in the triangular fossa here, which means spirit house. So when you're feeling all scattered and sort of scared, it brings you back into your center of your spirit. And then it also uses the lung point, the liver point, and the kidney point. This relates back to the emotions I was talking about. The lung is the house of sorrow. So when you're crying, you get sort of short of breath, and you're like, because you're crying. And so sorrow can be housed in emotions. I have a patient who is 88 years old and recently lost her husband, and she's been experiencing wheezing since then. And her doctors are like, we did an x-ray, your lungs are clear, we're not sure why this is happening. But in Chinese medicine, it's very obvious that because of the mourning she's going through with her husband, her lung channel and her lung organ itself isn't functioning as well as it could be because it's being encumbered by those emotions. The liver is more about processing the emotion of anger, but also like withholding what you feel like you really want to say, like not being able to speak your truth. And certainly in modern society, we can't just go around telling everybody like, oh, this is what I'm feeling right now. Like that's not really the socially acceptable way to be, at least in America. So frequently people experience liver issues where their chi is sort of being held back because they're not able to express that anger or that frustration or that integrity of your true self and just expressing that out in the world. And so that's where we work on the liver and sort of soothing that frustration that people feel from not being able to express themselves as fully as they want to. And then the kidney is where your vital essence is housed. So in Chinese medicine, we're all given like a oil lamp full of energy when we're born, and that's called the Jing. And that wears down over time, but we can supplement that with proper diet and nutrition so then we don't burn into it quite as quickly. But Jing also, and the kidney is also where the fear is housed. So like that's why like when children or dogs get scared, they might like pee themselves because that's the kidney, and the fear is right there. So we work on relieving those emotions and sort of just building up the vital essence through nutrition, and we can access that also through the acupuncture points. So that's a little sidebar on how the Zangfu organs play into the treatment strategy. My school in Racine, Wisconsin was sort of a Zangfu oriented school. There's many different ways of studying. Some do the 5 elements of Chinese medicine, which are wood, fire, earth, metal, and water, and how those things play in together. So there's many different sort of avenues, and when something's been around for 3,000 years, that tends to happen. Please stop me if you have any questions. So acupuncture is sort of our first line of defense. Well, ideally our first line of defense would be proper nutrition so you don't have to come in and get acupuncture at all. But acupuncture is also used for pain that might happen from like traumatic injury. Like I've treated a lot of people with like whiplash from like car accidents or low back pain from injuries of lifting things on the job. And those are definitely not only treatable by acupuncture, but being more and more incorporated into Western medicine. Like I was mentioning to you earlier, how in hospitals, they're now now triaging patients with chronic pain or acute pain with acupuncture in order to sort of stave off the opioid crisis that we're experiencing, to give people another avenue that's been proven very effective. And the National Institute of Health has many, many articles showing the research of how this ancient medicine is effective in a modern setting with modern scientific studies. So if you want to go down a rabbit hole, that's a good one to get to. But if you're experiencing pain or any sort of imbalance, acupuncture would be the first thing that I would recommend. So acupuncture is the use of needles to stimulate the meridians or points to regulate and unblock the person's energy channels in order to prevent and treat disease. So locally, if our gold woman was having back pain, we'd put points locally near where the actual pain is, but then because the channels work through the whole body, we might be putting some near the feet, which has correspondence with the liver channel, if part of the back pain is that they're not being able to move forward because of this frustration. We might be doing some on the arm. There's also an empirical point for back pain, that empirical meaning that empirical studies have shown over the years has become very effective in the back of the knee is actually for low back pain. So when I treat someone with back pain, I work both on their back and locally and distally, so that's down the channel as well. The way that the needles work is, of course, when you're putting a needle into your body, that sort of awakens the alarm system to send white blood cells and stimulate pain relief by releasing endorphins and hormones and other chemicals, but going to that area. And that's what it talks about here, about stimulating the points to get the chi or the energy flowing, regulates hormones, regulates circulation. Frequently I have patients who have cold hands and feet, like all the time. And by opening what's called the 4 gates, which are points in the hands and the feet, we're allowing the energy or the chi to circulate to the extremities better. And we've had good luck in treating people like with Raynaud's syndrome, with the cold fingers. It can also increase immunity. When I have a 4-year-old daughter, when she's feeling sneezy from dance class with her other 12 friends who circle up after doing that, there are points that I use for myself. There's 3 in the hand, 1 here, here, and there, that I am quick to do when I see that she's not feeling well, because those boost immunity. In Chinese medicine, it's called the Wei Qi, which is kind of like this force field around you that like keeps the germs out, which is sort of an ancient way to look at the idea of the immune system, which is what it's boosting as well. And then also, it can relieve pain by working locally and distally, and through the gate theory is one idea, that you're blocking off the neurons to the area of pain by like closing a gate, by applying needles in a lock and chain along the channel up to where the pain is. Like if I had shoulder pain, I'd put some in the shoulders and then lock it down the arm as well to bring that pain out. Okay. Chinese herbs is another way to supplement and support the effectiveness of acupuncture. When I finished school, we were in lockdown, so we weren't seeing people in the clinic. We were seeing people over telemedicine and pretty much just treating them with herbs. So we do all the intake, find out what the underlying pattern was, and then through the use of like 500 different herbs that range from like shells to gecko skin to mostly plants, we can formulate an herb specifically for the pattern for that person, what they're experiencing. And week after week, the patients would come back and report how they're doing, taking the herbs usually 3 times a day. And people did tend to report that their conditions were improving. Herbs are also very helpful for fertility cases when you're trying to help people boost fertility. That sort of clears out the imbalance and allows you to get back into your best harmony. Herbs aren't something that you really do long term. It's more for like acute issues to sort of get you back into balance, but acupuncture, then you'd want to continue to do as sort of a maintenance routine. When I was a massage therapist back in California, I'd get a massage weekly, and then I'd go in. I had worked it out that I only needed to go in once a season to get my acupuncture done. I think I would have had less shoulder pain if I would have gone more often, but that was before I really delved into the wonders of this medicine. So there are 3 parts of the body that herbs and acupuncture work on, which is the blood, the qi, and the jing. So the blood, of course, we all have blood, and so when you tell a patient, like, oh, you're sort of blood deficient, they're like, what? And what we're talking about is like the quality of your blood and how well it's nourishing your body. And remember, this is sort of based, everything is still sort of based on like ancient knowledge of the body, but if you work within the paradigm that's established within the Wang Di I Ching, the medicine is still effective. And that's why I encourage you to read those articles from the National Institute of Health, because they can make that connection between like what the ancient paradigm was and how that applies to modern medicine. I can talk about that too, but we'd be here all day. There are also accessory techniques, other forms of body work that are incorporated in Chinese medicine. So Tui Na is Chinese massage that stimulates the acupuncture meridians. So it can be very relaxing. I took 3 semesters in Tui Na. It can be just as effective as like Swedish massage, which is traditional licensed massage therapy. But more so we use like our thumb to kind of like get into those acupuncture points and really stimulate them. So it's like a massage with a little more purpose because you're using a little more acupressure is often what it's called. Gua Sha is all the rage these days. You see about it on like TikTok where people are using the stones on their face to drain the lymphatic system. And it really does help. The lymphatic system itself doesn't have any sort of pumping mechanism like veins and arteries do. So manual lymphatic drainage is very important, especially to get rid of, after you're sick, any like remaining kind of gunk that might be in your system. That's a technical term, gunk. And so gua sha can be done also, I use it primarily on people's neck because people get a lot of neck pain, and we really kind of dig in there. Gua means spoon, sha means sand. So I'm literally using a Chinese soup spoon that's ceramic to sort of scrape into the tissue to bring the blood to the surface to break up that lactic acid and that stagnant muscles that are there by increasing the circulation, by applying that sort of friction to the area. So you can do it cosmetically and sort of more gently, or for lymphatic massage is also gentle, or you can really dig in there if you want to get the blood flowing. Speaking of, cupping is another way to get the blood flowing. That's very effective. It's sort of like a massage in reverse. So a massage, you're pushing on the person's body and pushing the muscles, pushing down into the muscles, whereas cupping, you're sort of creating a suction and lifting the muscles up to release any adhesions where the muscles might be sort of attached too much to the bone or knotted up in themselves in like muscle, knots like everybody talks about. And so cupping can move those around, and you do end up with some marks, but it doesn't hurt like bruises. It looks like bruises, but it doesn't really hurt like bruises. It just moves all that stuck lactic acid and gets more blood flow to the areas where you're experiencing your pain. And then finally, moxibustion is a burning herb that we put on the different channels. So it has, the ones I use have a little pad, and then the herb burns down, and then when you feel the heat, I take it off. Moxibustion works with acupuncture in a way that if you think of acupuncture needles as little radio towers sending new signals to your brain to bring you back into the best balance it can, the moxibustion, through the thermic energy of the heat, boosts that radio signal because you're putting in actual energy through the heat transfer into the channels. So they really work quite nicely together. At the school I studied in Wisconsin, there was no smoking indoors, and that included moxibustion. So we used a little bit of moxa cream and then an infrared light to create the same idea of putting the heat into the channels. And I could sit under that light for hours. It's so comfortable. So then finally, frequently asked questions, people, like, okay, so you've talked about how it works, but what's an actual acupuncture treatment like? So we come in, we spend a good amount of time talking so I can get to know what exactly is going on with you, so then I can delineate a diagnostic and a treatment strategy with the needles. And then usually there's only about 10 needles inserted on your first treatment, because we don't want to be sending too many radio signals to the brain, right? We want to focus on what we want to get accomplished. And then when the needles are inserted, honestly, it says here patients experience a quick light sting, but many people don't feel anything. Some people do feel sort of like a dull sensation, which is called the da qi, or the arrival of the qi to the point, but that usually dissipates within a couple of seconds. And then I make sure you're comfortable and that nothing still is feeling off. And then you're left to relax for about 20, 25 minutes. And with, I usually have soothing beach sounds. I have waves going on, so you can have your acupuncture relaxation on the beach. And then the needles are removed and you go about your day. And what can acupuncture treat? Again, it's a whole range of diseases. We see it used for pain, modern in hospitals. We see it used for digestive issues, arthritis frequently, allergies, fatigue, headaches, anxiety, stress, and pain. I just took an extended education class in treating anxiety and insomnia with acupuncture. So there's always new avenues that continue to be opened and studied. And then how soon can I expect my results? I had one patient who had chronic stress headaches who they went away after one treatment. But that is definitely the pot of gold and not the standard. Usually we suggest, well, the study that they did at Stanford University for people over 65 treating chronic low back pain was based on coming once a week for 12 weeks. And after that whole regimen, up to 80% of people saw significant improvement. So with my patients in my practice, I've seen people usually come once a week for the first month, and then they start reaching sort of a turning point, usually about after 4 treatments. And then we cut down to like every other week, maybe once a month, depending on what your schedule is and how good you're feeling. So results can happen once, or if you have a more chronic, long-standing issue, it might take significantly longer to bring you back. Because if you're way over here on the spectrum of wellness, it might take longer for us to bring you back. But we can do it if we work together and we continue regularly seeing each other. Sometimes I'll have patients who have back pain and then they come in again once and then 3 months later and they're like, well, I'm not seeing any improvement. And I'm like, well, girl, I haven't seen you. So you do want to kind of stick with, just like taking a vitamin supplement. You don't take like one vitamin C and expect you're just going to be like, okay, I'm fine. You got to sort of keep it up until you're starting to feel better. So that's my presentation. I'm going to pass around the ears so you can see all the different points that are available auricularly. And then my gold person. And if you have any further questions, you can reach me. I've got my business cards at balikabalanceacupuncture@gmail.com. Thank you for coming.